Good day, listeners and viewers, and welcome to the COVID-19 update for today, Wednesday, October 27, 2021. I am Godfrey Brooms, and I'll be joining the Minister of Health, Dr. Frank Anthony, who will be updating us on what Guyana will be doing with its share of the US $2.5 million that the US government will be pumping into CARICOM to fight against the COVID-19 pandemic.
The US is injecting some $2.5 million into CARICOM to fight COVID-19, and Guyana is set to be on the list of beneficiaries. Can you give us an idea of how exactly the countries will benefit from this money?
Well, we have had discussions with USAID, and among the things that we had flagged with them is the whole notion of vaccine hesitancy, because across the region, a lot of people still harbor a lot of myths pertaining to vaccines, and because of that, it has maybe deterred them from going and take the vaccine. We know that in this pandemic, if you're not vaccinated, you have a higher chance of getting infected and getting hospitalized and even dying from COVID. And therefore, vaccination is extremely important. So these funds would assist the countries in the region to improve their communication with the general population, encouraging them to get vaccinated and understanding the benefits of vaccination. It also comes at I would say, a critical time when vaccines are now being approved for children. And as you would see, that there have been discussions yesterday pertaining to the FDA approving emergency use authorization for Pfizer vaccine for children 11 to 5. So that's an important step. And maybe by next week, the CDC would also do the same. So once that approval is given, it opens up to a larger percentage of our population who would be eligible for vaccines. So it's coming at that critical time, and I'm sure that some of the countries would use the funding to educate parents, to educate teachers, to educate the general public pertaining to vaccination, especially among children. Well, it's not a new vaccine. We have been using Pfizer for a while now, and I think people have become more acquainted with it. The track record, the safety of the vaccine is there, so people can analyze that safety data. So there's nothing wrong with the vaccine, and it has gone through several rigorous studies, so we know that it's a safe vaccine. The benefits of this vaccine far outweigh whatever risk they might be. And that is why we are urging parents and adults to get vaccinated, because this is the parents and to encourage their children to get vaccinated. I think that's very important. We want to open schools. We want children to go back to school, because you would know over the last year there has been a lot of learning loss, meaning that the curriculum has not been adequately covered. The material that children ought to cover, they have not done so. Many times when they're supposed to be online studying, because they're not supervised, they're probably not able to study properly. So these things have affected how children learn, and definitely would create a learning loss. And we would see that showing up more when they're ready to write various exams. So we have to get children safely into schools, and one way of doing that is ready for them to be vaccinated. So with the impending approval of Pfizer for the 11 to 5, potentially we have primary and nursery school kids getting vaccinated and can start returning to school. Well, it's based on surveys that we will do. We'll try to find out, first of all, what are the concepts that people have, maybe what misinformation is circulating. And by understanding that, then you'll know how to respond. We have been doing some of that. We have been collaborating with Johns Hopkins University. They have a program in Guyana, and we have adopted that program. It was originally for malaria. We have adopted that program now to respond to some of the rumors pertaining to COVID. And therefore, that program has been helpful in putting out facts rather than the kind of misinformation that we have seen circulating. So this program has helped us to counter some of that misinformation. So the funding that we will receive from USAID would go into helping us to respond to some of these things, because on a daily basis people are on social media and they receive all kinds of misinformation from social media and they tend to believe these things. So we have to now come up with a program to counter that. Delta Plus variant is now being detected around the world. I think they first detected these changes in the genetic sequencing of this particular virus in the UK. So currently about 6% of the samples that the UK have been sequencing are now showing the variation, which is now being referred to as Delta Plus. It's the other name for it is AY 4.2. So that connotates the genetic sequencing that have been altered. These mutations, so far they're not sure what the mutations would mean, whether it's more transmissible, whether it would cause more severe disease. That is still under study. For these mutations in the Delta variant has been deemed a variant under investigation because they just don't have enough information. They know, however, and they have detected this particular variant, if you like, or variant under investigation, circulating in about 116 countries. So already it's widely dispersed, and with more studies we'll get a better understanding whether this is creating more severe disease, whether it's more transmissible than the original Delta. So we'll learn a little bit more in the upcoming weeks. With the adults 18 years and over, we now have 379,435 persons receiving their first dose. That's now 74% of our adult population would have received the first dose vaccine. And with second dose, we now have 240,025 persons who would have received that second dose vaccine. So it's now 46.8% of our adult population that would have received second dose. Again, I just want to emphasize that, as you can see from these numbers, we have second doses lagging, and therefore those persons who would have received a first dose, we want them to come and get a second dose. Some people might believe that because we have a requirement, at least you get one dose of the vaccine and you're considered vaccinated. While that might be for administrative purposes, for the protection of your health, if you don't get both doses, then you are not going to get the benefits of these vaccines. It is important that people get both doses. So we want to make that appeal again. If you got your first dose, please come back to one of the vaccination sites where you can get your second dose. In terms of children right now, 12 to 17, first dose, we've completed 27,055 children. That's about 37.1% of that age cohort. And we now have 17,647 children for second dose. That's 24.2% of that age cohort. So again, there are lots more persons within that age category that are eligible for vaccination. We need to reach them, whether they're in school or out of school youth. We need to reach them and make sure that they're properly immunized.
And that's it for the COVID-19 update. For more information, you can visit the Ministry's website at health.gov.gy or DPI's website at dpi.gov.gy. Godfrey Brooms is saying goodbye for now.